We
This
are
conference
surrounded
will
by
now
the
be recorded.
large though we are surrounded by large number of infectious organisms that we are breathing, we are sitting everywhere, the microorganisms are present, but still we are not suffering the disease because of our soldiers, which are our immune cells. But once these immune cells are damaged, we land up into the infection. So HIV is one such virus which damages our cell mediated immunity, that is acquired immunity, that is CD4 cells, which are the center of our immune system. Those are called helper cells. So once the CD4 cells are damaged, our body is prone. So our body is prone to large number of infections, as a result of which we land up into opportunistic infection and we die. One more important point about this HIV is caused by retrovirus. Retro means reverse. Because it has reverse transcriptase enzyme, it is called as retroviruses. And these viruses has a very large incubation period, sometimes years also. As we see with HIV also, the
cerca materiale magari rapido చెప్పండి మా సైడ్ నుంచి పెళ్లి చూపులకు అంతా రెడీ అయ్యారు సూక్ష్మ గారు సుహాసిని గారికి పర్ఫెక్ట్ మ్యాచ్ ఓకే అయితే హ్యాపీస్ట్ పర్సన్ అండి ఏం మాట్లాడొద్దండి పేరెంట్స్ పిల్లలకి ఫ్రీడమ్ ఇచ్చేది ప్రేమించుకోవడానికి కాదండి ఏదైనా సాధించి
Starting connecting. Sorry, we had network issues, so we could not catch you. Anyhow, going with, I was telling about HIV virus. HIV is human immunodeficiency virus, which is transmitted among humans only, preventable by humans only. It's a preventable disease, but once we get the infection at some point of the time, the patient will lose the life. So HIV is human immunodeficiency virus. So what is AIDS? AIDS is an end-stage part of the HIV, which is not seen in all patients. Before the patient arrives into AIDS, usually they may lose their life because of opportunist infections, but very few people will land up into AIDS. So acquired immunodeficiency syndrome received, which is not an inherited one, because there are some inherited diseases which causes immunodeficiencies, which we studied in immunodeficiency diseases chapter of immunology. You would have seen in the last one or three chapters. You can see immunodeficiency diseases, acquired immunodeficiencies, and congenital immunodeficiency diseases. So this is acquired immunodeficiency disease. Immunoprotected from, in this case, the system protects the body from the disease. Deficiency, lack of, and syndrome, group of symptoms. So HIV, you can see, yeah, it was first identified in the USA in 1981, somewhere around that. Suddenly, they didn't identify. There was an outbreak of some rare diseases which usually thought to be very rare. One is pneumocystis carinii pneumonia, and second one was in US, especially Kaposi sarcoma cases. So Kaposi sarcoma, we have already studied in the herpes simplex, herpes virus 8. So there was a group of people, that is homosexual individuals. They initially identified a homosexual individuals where they had this carcin, that is Kaposi sarcoma. They did not find what was the reason behind this. Later, when they identified that herpes virus was just a opportunistic infection seen in those individuals who are infected with HIV, which damage the immune system. So that was a secondary infection, but the primary culprit was HIV. So you can see that in 1930s only HIV-1 arises, but it did not affect anybody. 59 earliest seropositive cases. Actual emergence was from 1981. AIDS emerges. HIV-1 identified in 1983. 86 HIV-2 identified, whereas now advent of human antiretroviral therapy, which has prolonged the life of the HIV affected individuals. And now in 2006, AIDS Prevention Committee has come into the picture. So every year, December, first will be followed as AIDS Day, where we take up one oath which will be continuing for 1 year, so that we try to reduce the mortality and morbidity of HIV, try to increase the research. See, you can see from so many years also we are not able to control the HIV. It has been present as an endemic disease, and we are trying to find out the vaccines also, but we are not able to we are not been successful in preparing a vaccine of even after so many years of the disease. Control prevention is the only one. One good thing about that is advent of antiretroviral therapy, which has prolonged the life of many people. Initially, the lifespan was hardly 3 to 4 months, but now the lifespan has increased up to 30 years, and even counting also. So with this background, I move around. So HIV/AIDS, the first documented case, as I already told, 1959. So first case of evidence in gay men, that only I was trying, homosexual individuals. In the first world countries, AIDS is now a chronic disease, but this was not the case in the past. Even in India, it's a chronic disease. It's an 100% preventable disease. So little bit about the history in 19 India. In India, milestones in India. If we take in India, first case was identified in 1986 of HIV infection in sex workers in Chennai, and AIDS case in Mumbai. 89 HIV infection reported among intravenous drug abusers. See, this is the second most after the sexual. I mean, though in India homosexual contact is not that common, heterosexuals first identified in heterosexuals, later intravenous drug abusers. So these are the mode of transmission. You can see these two are in the highest part for the transmission of the HIV. Of course, now blood transmission also come into the picture. 1991 Indian National AIDS Control Program was launched. 2001 India PMTC feasibility studies initiated by NACO. So national acquired. This is community which takes all the decisions on HIV. That is National AIDS Control Organization. This also identifies what are the prevalence and incidence of HIV, how to prevent HIV, how to motivate the people, what are the tests available to identify HIV, how to what are the tests to be done for confirmation, how to monitor the patient, what are the antiretroviral, everything is by NACO in India especially. So they are always updated. They do even update us. We have NACO guidelines also for lab testing, for treatment strategies, for prevention, everything. Whatever, if you speak about HIV, it is NACO. 2001, Indian pharmaceutical companies marketed antiretroviral drugs, which is considered at a price reduction. So as we move on, how did HIV arrive? HIV-1 likely descended from Simon immunodeficiency virus, that is, which was initially seen in panpronglettes, whereas HIV-2 is from Sooty Mangabe. Whereas origins of HIV, you can see chimps are only rarely infected with SIV. Actual reservoir may be some third unidentified primate species. So you can see global prevalence of HIV-1 is very high when compared to the HIV-2. HIV-2 initially was identified in West Africa, and now it has been concentrated only in few areas of the world. You may ask whether in India HIV-1 or HIV-2 is prevalent. Both HIV-1 and 2 are present. Again, HIV-1 is widely prevalent in all the areas of India and all the places, whereas HIV-2 is present in some of the South Indian states. So as we are in the South Indian state, even we do cases, we do these tests in the central lab. Rarely we do come across HIV-2 cases. Some of the cases will be infected both with HIV-1 and 2 also. So that cases also we have come across. So you compared, why, you may ask me why you need to differentiate HIV-1 and 2. HIV-1 is more virulent when compared to the HIV-2. Progression of the disease is very high in case of HIV-1 when compared to HIV-2. Infectivity is also high in HIV-1 when compared to HIV-2. And tomorrow the disease recovery rate, I can't, prolongation of the life, I can't tell you that complete recovery will be there, but prolongation of the life and complications are less when in HIV-2 when compared to the HIV-1. I mean, survival rate is high in HIV-2 when compared to HIV-1. So this HIV virus belong to the family Retroviridae. Retro means reverse because it has a reverse transcriptase enzyme, that is RNA dependent DNA polymerase. It is called as Retroviridae. There are many retroviruses, of which HIV-1 belonging to the family Lentivirinae. Icosaheteral enveloped virus. This is also an enveloped virus, which is an RNA positive sense RNA virus. And next picture I'll show you what are the characteristics of this virus. It has two viral strands. You can see here two viral strands of HIV, single, it's not a double stranded, it is a single stranded, two single stranded RNA virus is there, which is a protein coat. Outer envelope is a lipid one, which is derived from the plasma membrane of the human cell, which contains specific glycoproteins. These are knob-like structures responsible for binding to the target cell. You may ask me why I am telling you in detail about this morphology of viruses, because we are laboratory persons. Because of these spikes or these envelope proteins only, we have developed antibody tests and also antigen tests. Because of that, you need to know the structure, not only as a microbiology person. Tomorrow when you become a clinical person also, you should be aware of which tests are available and what is the credibility and of these tests, and how far we can trust this test. So all these are possible only if you know the detailed structure of HIV. Structure of HIV is very important. It can be a long question. Please be careful. Please note the diagram also. You can see this is the proper one. This is icosahedral wedge-shaped nucleocapsid. This is the nucleocapsid, but outer coat you can see it is a spherical shape. In general, HIV virus is a spherical shaped virus, whereas inner nucleocapsid, this one you can see, I am just pointing the monitor, the cursor. This is icosahedral wedge-shaped nucleocapsid, which has two RNA particles, single-stranded RNA particles, and there is one reverse transcriptase enzyme, RNA-dependent DNA polymerase. These are the enzymes so that it can synthesize its own DNA. So this is the lipid membrane. So this is spherical in shape because it's a lipid envelope. I told you this is derived from the humans, that is host cell. So these outside you can see these spike-like structures. These are not for any beauty. This is spikes are very important. One is GP120 and it has a pedicle also, that is GP41. Please remember this. Of course, I'll be explaining in detail also, because treatment or your laboratory tests, everything on this. Because of this, we are even trying to prepare vaccines on this basis also. So this is single-stranded positive sense RNA, as I already explained. This is in simple way structured virus. Okay. So HIV genes are two genes are there. Please mute yourself. All of y'all, please mute yourself. I can hear some disturbances. Please don't disturb. Already we are in delay because of network problem. So HIV genes, you can see two types of genes which are important. One is structural genes, another is non-structural genes. So as we go on in structural genes, you can see this CAG gene, Paul gene, and envelope genes. So envelope genes already I explained. Envelope codes for envelope glycoprotein, that is GP160. GP160 can again be divided into two parts. One is GP120. What is the purpose of GP120? Binds to the CD4 cells. You can see it directly attacks your immune cells, that is cell-mediated immunity. Its receptors are present in CD4 cell only. So directly it damages our soldiers. So all of us are in danger immediately. So don't underestimate the HIV disease. It's a very dangerous one. So GP120 binds CD4 cells, whereas GP41, which is a fusion protein, which helps in the fusion to the host cell. This is envelope proteins. Whereas if you come to the GAG one, it codes for the core and shell, that is P55. P55 can again be divided into three proteins. One is P18, that is matrix or shell antigen, whereas P24 and P15 core antigens. Of all these three, I would like to tell P24. Please remember P24. Why? I'll tell you when we come into the lab diagnosis. So P24 antigen is very important, which codes for the core and shell. Core and shell, indicating specificity. It is quite specific. So Paul genes, you can see this Paul genes codes viral enzymes, that is reverse transcriptase, protease, and integrase. Precursor protein is there, which divides into P31, which codes for integrase, P51 reverse transcriptase, P15 core antigen. Of all these, please remember three. One is GP120, GP41, and but not the least, that is P24. Of course, other genes are important when we go into the molecular studies, but at your level, please remember these genes. I would like to explain you at the end when we are speaking about the laboratory diagnosis, why they are important. So non-structural genes, I've just mentioned this. Of course, these don't have any laboratory importance or treatment importance, but still we need to know. So I've just explained. TAT gene, that is essential for HIV replication. NEF, negative infective factor, that is increases viral infectivity. VIF, viral infectivity factor gene. VPU, promotes CD4 degradation. VPR, transports of viral genome into the nucleus. VPX is there, and promoter enhanced integration LTR, long chain transmitters, REV regulator virus genes. So these all of them have their specific functions, which only we need to know about these genes. So classification, coming to the classification. So with the genomic molecular classification, they can, because HIV is more prevalent worldwide, they have divided HIV-1 into three major groups. One is called as M for major, O for outlier, and N for new. New ones have come into the picture. They have found only in the West Africa, Cameroon's one. Outlier also they have found only in the West Africa and Cameroon. So both Cameroon is also in the West Africa. Whereas M for major, these are worldwide. These major genes have again been classified into 10 subtypes. That is A to J. So you please remember A to J. So HIV-1 subtype A, that is worldwide. That is, all these are major type. You can see worldwide 10 subtypes, that is A to J. Whereas 8 subtype is worldwide in distribution. B in America and Europe. C type subtype A, C, D are found in Africa. Whereas subtype E, C, B in the Asia. In India, subtype C is more prevalent. You may ask why you are going in that detail, madam, for all these subspecies. Yes, we need to know, because the virulence factor, infectivity factor, the treatment part, everything changes with these subtypes. Of course, that will be a minor change, but still we need to know which subtype is prevalent in which area. So in India, at this point of time, you can remember subtype C is more prevalent. So most of the time these things will be left over, but I would like to tell how can you kill a HIV virus, because tomorrow you'll be working in the wards, tomorrow you'll be a house surgeon, or you'll be a successful clinician. In such cases, you need to know. Most of the people doesn't know how the HIV will be inactivated, which agents, which chemical agents can kill, or disinfectants or antiseptics can kill the HIV. See, you can see a list of one which can kill the HIV. Of all this, I would like to remember this always. Even most of the examiners do ask this question, but sadly our students don't turn up. Even I try to ask them in the prelims, they don't turn up. But anyhow, this time I had a chance to speak about HIV, so I'm just speaking about this. You can see the last two. 0.5% sodium hypochlorite solution is the standard one. See, this hypochlorite solution now it's available everywhere. With the outbreak of corona, still commonly it is available. Okay, if still you don't find this hypochlorite in PHCs or in the lower centers, but still you feel that is HIV positive blood, please go for household bleach. Hypochlorite solution can be replaced by household bleach, that is 10%. So it's almost equally competent enough to kill the viruses. Bleach is almost present everywhere, easily available. So this is the standard recommendation in the hospitals. If not available, please go for bleach. Let it stand for some time. Then only you can this effect of disinfectant will be there. Apart from that, your daily household disinfectants like 0.5% Lysol, 35% isopropanol, 50% ethanol is always useful. You can see your common spirit, 70% of ethanol it will be there. 35% isopropanol also is also available. So your normal disinfectants sorry, antiseptics are equally effective against HIV. So whenever you are working in the wards, whenever you come across a point plate or any patient you feel HIV positive or non-positive, according to universal precautions, now you need to consider every patient to be HIV positive, or of course now with the pandemic, every other person to be corona positive, and take your universal precautions. Aim is not to insult anybody. Think that every person, everywhere you have this virus infections, keep yourself safe. That is universal precautions. So modes of transmission, all of you all aware of this because it's a very common disease. Mode of transmission, you can see direct way and indirect way. To put up in a proper way, direct way you can see splash of infected fluid. So whenever you are doing some procedure, you are cleaning the wound, or you are trying to take a pleural fluid, draw a fluid, a pleural fluid or pericardial fluid, ascitic fluid. In such cases, your procedure there may be a spillage. So in such cases, you can see 0.09% transfer of the fluid, or sexual route you can see 0.1 to 1%. So you can see this is increased. So it may be oral sex, vaginal or anal. Digital sex also can transmit the infection. Inoculation under skin and mucosa is another way. Vertical transmission. Vertical transmission is from the mother to the baby. 30%, you can see such high rate of transmission. So mother to baby. So this should be avoided because baby's immune system is already weak, because it takes some time to develop, mature. In such cases, babies may land up into chronic infection, and see the high rate 30%, antenatal 22 to 23 to 30%, intranatal 50 to 65%, and postnatal 12 to 20%. You can see this vertical transmission, anti-intra, all high rate of transmission. So only PPTC came into the picture for screening all pregnant ladies. So compulsory screening of all pregnant ladies is necessary. So if they turn out to be positive, maximum avoidance, try to avoid the infection. See that baby is not infected by various methods. So indirect way, vehicle-borne transmission can be there by body fluid or tissues. Transmission of blood and blood products. You can see this is high, 90%. Blood and blood products. So all the blood products, whatever blood is being given to the blood bank, will be screened for HIV. Then only it will be transfused. Without screening, if they transfuse the blood, that can be a medical legal case. So organ or semen transplantation, you can see this also 50 to 90%. So these two are also high way of transmission. So all organs also will be screened for HIV. Then only they'll go for the transplantation. But if that fails, that can be the doctor can be sued in the court of law. So as we go on, you can see these are the just a picture description: sexual, pregnancy, childbirth, injection, drug abusers, occupational exposure, that is healthcare workers are at high risk, blood transfusion, organ transplantation. So this is the way how HIVs can be transmitted. So what are the relative risks? So relative high risk is sharing needles, unprotected sex, and breastfeeding. Low risk, protected sex, any opportunity for exchange of body fluids, that is blood, plasma, blood products. No risk is casual contact. Please remember, there is no risk with casual contact. Please don't isolate the patient, because already the patients are in a sort of depression, that because they have landed up into that serious disease. So we should be very careful. So some of the other precipitating factors I would like to tell about is age. Of course, most of the time adults are at high risk, especially a young age group. Sexual age group people are at high risk of getting the infection, because they are active persons. When compared to the occupation, healthcare workers or sexual workers, all these people are at high risk. Iatrogenic infection, that is your hospital acquired infections, the physician induced. So these iatrogenic infections can also occur in the hospital workers. Drug addicts, which are already spoken about. Multiple blood transfusions are also the risk, especially those requiring for some of the chronic multiple blood transfusions are required. In all such cases, you can land up into HIV. HIV infection. So careful, we should be very careful about that. So HIV virus incubation period, that's only I was trying to tell you, it's a retrovirus. So your incubation period can be very long, which can be uncertain, and from months to a year, or it can be up to 10 years. So 10 years also, though the patient might be suffering from the, will be positive for HIV infection. And one more bad one, but he may not exhibit any symptoms. But one bad thing about that is he is infectious and he can transmit silently to infection to the other people. So that is the bad point about HIV infection. So though the patient is asymptomatic, he doesn't have any symptoms, so he don't even go to the doctor, but HIV is present in the body and he can easily transmit the infection to a lot of people. Portal of entry, skin and mucosa sites, almost any body organs, tissues, all cells are susceptible, but CD4 cells are the first things which come into the picture. You can see this HIV virus. Already the structure have been explained in detail for you. So this is the virus. The virus comes and attaches with its receptors to the CD4. This is the CD4 cell. This is the CD4 receptor because it has affinity for the CD4 only. Those receptors, after binding here, it is taken up into the cell by endocytosis. Once it is taken up into the cell by endocytosis, the envelope is removed, the lipid coat. Removal of the protein envelope will be there, that is lipid envelope. After it is removed, viral RNA comes out, and this viral RNA, with the help of the reverse transcription or enzyme, it is transferred into viral DNA, and this viral DNA, single-stranded, this cellular DNA becomes double-stranded, and this gets integrated into the host cell chromosome or host cell DNA, as a result of which the integration is complete and now mRNA is synthesized. So these mRNA particles transcription, 10 minutes late kada. This mRNA particles, this mRNA particular translation occurs, that is protein synthesis occurs. Once this protein synthesis is completed, finally assembly of the particles occurs, and these will be released with the help of the plasma membrane envelope, which will be coated, that is because it's a lipid virus. So this is whole of the life cycle, replication part of the HIV virus. So in simple way, if I need to tell you how HIV destroys the immune system. So this is step 1, HIV1 genetic material. It attacks, HIV attached to the helper T cells. Once it attached to the helper T cell, HIV invades, enters the helper T cell. This is the helper T cell, HIV entered here. After entering, it multiplies within the cell. Once it multiplies, a cell is destroyed and it releases the virus. These again go and attack the other cells, and as a result the cycle continues. So these are the pathogenesis simple way. Virus enters healthy person, destroys white T cells and reproduces itself. Immune system breaks down on broken down cells cannot fight infection. Again, AIDS has taken out. When the CD4 cell count is that less that it cannot fight infection, we'll end up into the AIDS. So coming to the natural course of HIV infection, you can see initially when the virus enters our body and viral load has increased here to the peak, and here we have mild symptoms like acute infection. More than half of HIV infected individuals experience flu-like symptoms during this stage of infection, often called seroconversion. Here your HIV antibody tests are also negative. Please remember, HIV antibody tests are negative. So we should be very careful how we select a test. Of course, laboratory diagnosis I am not discussing today. That will be discussed in the next class by the next speaker. So again, after this, once your antibody production starts, the viral load comes down. You can see, once this viral load comes down, and once this viral load is down, here during this period the patient usually is asymptomatic. The immune system helps reduce viral load for a period of time, but replication is constant replication is happening. Immune system works to remove the virus, but once again this replication, chronic replication is happening, but it destroys more and more cells. Again in the end stage, your CD4 cell counts or immune system becomes weak, and your viral load increases, whereas your CD4 cell count decreases. So opportunistic here you can see viral load is high. Opportunistic infections occur as the CD4 T cells drop. So this is whole of natural history of HIV infection. So initially you can see exposure, no infection, it may be asymptomatic. If you have an infection, window period is there, that is called as seroconversion, where your antibody tests are negative, whereas after some days, 14 or 15th day, your antigen test can be positive, whereas your PCR test will be positive on the 7 days. That 7 days period, all the tests comes out to be negative. So these are also asymptomatic. Initial symptoms last for few weeks, mild flu-like illness that usually we think some other viral infection, we don't go into HIV, fever, muscle aches and swollen glands. We usually miss this. Asymptomatic period, it may be for years. You can see 8 to 11 years. Average progression may vary depending upon the person. If the patient's immune system is quite good, that may go on for very long, whereas if immune system is weak due to some other diseases, then he may land up into AIDS at the earlier stage or opportunistic infection. If HIV illness comes, symptoms include night sweats, fever, diarrhea will be there, swollen limbs. Okay, as we go on, I'll be explaining the stages, then I'll be telling you. AIDS is the final stage where your CD4 count is very less than 200 or less. One or more of the opportunistic infections will be there, like candidiasis, TB or anything, wasting syndrome, HIV related dementia. So window period, average time it takes for the body to produce antibodies is 2 to 12 weeks. This is important for you all to remember. Usually it is about 3 months, but it can be up to 6 months. Of course, very rarely 1 year. Usually, according to NACO guidelines, it's 6 months. Why you should know? Because you have tested for HIV infection in the initial stages, and the HIV test has come out negative. But don't tell that patient is completely negative. Ask him to come even after 12 weeks. So then also, if your patient is negative, if the patient explains you that he has a history of exposure, then ask them to come at 6 months, thinking that there is no exposure in between, so that after 6 months also, if there is no exposure, new exposure, and the patient is negative, then you can consider him as negative. Of course, now we have antigen tests and molecular studies which support your antibody test, so that things have become easy. I'll go little fast because we are running off time, because your pathology professor is already there. So group 1, acute HIV infection, which I have already explained, which usually have a generalized symptoms which are non-specific, which most of the time we neglected during the seroconversion period. So group 2, the acute HIV infection, where we have HIV antigenemia, P24 antigen demonstrated. You can see this seroconversional illness during this period, day 0, no test will come out positive, whereas 7 to 10 days, you can see your RNA PCR can detect the HIV infection, potential exposure to HIV. Whereas confirmation on day 16th, you can do P24 antigen, which is specific. If comes positive, you can take it as positive. Again, for the confirmation, you can go for day 28. You can go for 4th generation antigen antibody test, where both antigen and antibodies can be detected, and this will turn out to be positive. Both antigens and antibodies can be. And last, on day 90, only antibody test, where again antigen test will be negative. Final stages, again patient come out to be antigen test positive. So group 2, asymptomatic or latent infection, lasts for several years. High level of viral replication is there, shows positive HIV antibody tests are infectious. All stages, please, again I repeat, patient is infectious. So we should be very careful here. Next, asymptomatic stage usually lasts on 8 to 10 years. Already explained you. In rapid progressor, AIDS develop within 1 to 2 years, where we have other precipitating factors or malnutrition, where the body immune system is weak. Whereas long-term non-progressors, 5 to 10%, you can see, remain symptom-free for longer than 20 years also. You can see 20 years also. So present in about 25 to 30% of this persistent generalized lymphadenopathy, 25 to 30% of patients who are otherwise asymptomatic. You see lymph nodes which are enlarged. Presence of enlarged lymph nodes at least 1 centimeter in diameter in 2 or more non-contagious extra-inguinal sites, at least for 3 months. That is the describing feature of persistent generalized lymphadenopathy. Last AIDS related complex, and last one is AIDS. Features of disease progression where downward trend of CD4 count cells, CD4 count drastically drops, the ease of viral culture, presence of P24 antigen. Again, P24 antigen becomes positive. Initial stages it was positive. Once the antibody has taken hold, P24 antigen will be negative. Again, it will be positive in the final stages. Loss of antibody to P24. So in the last stages, P24 antigen will be positive, whereas antibody will be negative, indicating our body immune system has gone up to a very bad stage. AIDS related complex, again here patient may land up into chronic symptoms. Here diarrhea and all due to opportunistic infection, that is parasites like cryptosporidium, isospora, cyclospora, where they have uncontrollable diarrhea and weight loss. TB is still the common opportunistic infection in India. As we go on, we have major signs like major weight loss greater than 10%, fever for longer than a month, and diarrhea for longer than a month. Minor signs like persistent cough, thrush in the mouth, that is due to candida infection. Some skin lesions are there. Some these herpes virus which are latent. Usually, most of the time we have herpes exposure in India. So these latent viruses also become activated because of your immune system is weak, and they may show up with shingles. This is, you can see, this is herpes zoster, shingles, and other symptoms, as a result of which we may land up into serious disease. So AIDS is an end stage disease. CD4 count is very less, and again viral load increases, our body immune cells will be decreased, so they may land up into various complications. You can see this is Kaposi sarcoma is also one of the disease which initially they identified. So this in general tabular column which I have already explained. Normal healthy gets infected HIV. Window period is 3 to 12 weeks. It may go up to 6 months also. HIV positive usually a long period of asymptomatic stage will be there. Finally, it takes 10 to 12 years for the development of AIDS. So pediatric AIDS also is very important. We need to remember. So protect your mother and child also. Antigenic variation and diversity is very high in this case, as a result of which we are not able to prepare the vaccine even after 30 to 40 years of a high rate of chronicity of HIV. So error-prone nature of reverse transcriptase enzyme, different mutants selected under different conditions. Mutations can occur at any genes. I've explained, so only we were trying to explain all the genes here, structural and non-structural genes. Most common mutations are seen in structural genes, mostly envelop major target, that is GP120, GP40, GP160 genes is the why. Explain HIV waits fast immune response. Vaccination against HIV is extremely difficult. So these are some of the opportunistic infections. You can see system wise I have there. These are there in your textbook because we are running short of time. I'll just move on. You can see this is one is Kaposi sarcoma, oral candidiasis, oral hairy leukoplakia, and pneumocystis carneae. So as we go on from the system wise explanation, you can see brain, eyes, mouth, and also all system opportunistic infections are common. This next picture I would like to tell you is this is all infections. So viral infections can be there, fungal can be there, bacterial can be there, miscellaneous cancers, protozoan, any infections. In fact, fungal infections importance has raised because of this HIV and organ transplantation only. There before that, fungal infections are very, very, very rare. So life expectancy, you can see in 1980s when the initially HIV arrived, it was only 3 months because we didn't have good detection methods. We didn't know how to improve the lifespan. But now today, because of increase in the nutrition for a healthy food and psychological support, it is 27 years and counting. And we have very good antiretroviral drugs which are very supportive. So we need to support the patient at every stage so that we can have a good outcome. We can decrease the mortality so that patient can survive. So one thing I've just put up, you can read to yourself only. This does not transfer the HIV. Please don't depress HIV patient who may be your friend or your patient, because with this does not transmit the HIV. HIV is easily preventable disease. The transmission has already been explained. So 1st December World AIDS Day is being celebrated since we have a slogan for every AIDS day, so that we try to follow it for 1 year. Thank you.